Since the start of Covid-19, over 380,000 children have tested positive in the U.S. What are the healthcare industries doing to improve consumer trust and how to stay current with the changing landscape of healthcare?
COVID-19 has put many people out of work. We're one of the few private practices in our region who cares for families with Medicaid. And we have seen an increase in percent of our population who is on Medicaid. We are working with a community organization that cares for families with no health insurance. And so we are working with them to care for those children. The biggest challenge we have right now is having adequate testing materials, maintaining adequate supplies, and maintaining adequate testing material remains a challenge that we continue to work hard to meet.
Lack of coverage is causing less access to care.
Access to health care and the rising cost of care in the United States is a very complex problem, and it was very important that young adults remain covered by their parents' insurance. Obamacare provided some safeguards for people, particularly for young adults. Early in the pandemic, the biggest concern was access for healthcare providers to personal protective equipment. Thankfully, we now have enough in my practice, so our practitioners do feel safe.
How is technology impacting the healthcare industry?
Prior to the pandemic, my pediatric practice had not begun doing telemedicine. Because of the pandemic, it became critical that we have that capacity. We are increasingly aware of the inequalities and taking steps to make sure that we in healthcare are always providing equal access to opportunities, and that no one ever experiences discrimination for any reason, whether it be gender or socioeconomic or race.
According to AMA, the government should provide efficiency of workforce by instituting medical liability reform and reduce government and insurance control over healthcare costs.